Hello, good morning, good evening, wherever you are watching. This is Tala Jobe with your program that comes to you every Saturday called The Hard Talk. Today on this platform, we have our sister, our partner in development, Mrs. Mariama Samateh, who is also a Gambian based here in the United States of America. Today, our topic will be on mental health. But before I go further, I'll want to welcome my sister, Mariama. Welcome to Sukuta Community TV.
Thank you very much, bro, for having me. Thank you for giving me the opportunity to talk about a very, very important topic, which is mental health and how it relates to what is going on in the world, the pandemic, and also the Gambia as a whole, the mental health status of mental health patients in the Gambia. So thank you very much for having me.
Thank you, Mariama, for also honoring our invitation, though it was prompt, but putting consideration and the importance attached to serving voluntary basis public health issues. Gambia is not an exception. We have a lot of issues relating to that. The pandemic is there, and there are so many issues that we could do around. So basically today, like we said, we are going to look at things from the global pandemic, to say COVID-19, in relation to mental health. You know, basic things. What is mental health to people that might say, what is mental health? In a simple term, how do we understand the word mental health from a professional point of view?
Mental health from just a layman's point of view, I would take it, because, professional point of view would, we use a lot of jargons to describe what mental health means. Right. But from a layman's point of view, what mental health means is the health of your mind, the health of your brain, the health of how your emotional well-being. What is the health of your emotion? How can you regulate your emotions to be able to deal with the society at large, or how can you regulate your emotions to be able to deal with the day-to-day functioning of your own daily life. So that's what mental health means. If you have a right state of mind, you are in a much better position to be able to handle the daily activities of life, to be able to handle whatever goes on, your personal interactions, and anything that comes your way that requires you to maybe think, analyze, or behavior-wise act.
I know mental health is becoming now a major public health problem, and Gambia is no exception. From the Gambian perspective, what do you think are the major causes sometimes of these mental health problems?
Mental health globally, I don't think that is specific to Gambia per se. Gambia has its own set of issues that can maybe contribute to mental health issues on the ground. But generally, mental health, some of them are genetic. Some of them, can be passed on from generation to generation. Others are, a lot of mental health issues stem from stress. and how we handle it. And sometimes when you say stress, people will tell you, well, we all go through stress, but not everybody gets ill mentally. The thing is that genetically, we all are wired differently. So, for instance, you may go through some type of a psychological stress that will not have any bearing on your mental illness. But if I go through it, then I will have that problem. So yes, it's largely based on our genetic traits, but it's also based on psychologically how we are wired, and also environmentally things that happen in our environment that causes us to be stressed, that causes us to have mental illness. So it's three things: genetics, psychologically, and environmentally.
Good. Partly, if you look at the environment, how does the environment contribute to the mental well-being of an individual?
Yeah. For instance, our environment contributes a lot to our mental well-being. For instance, let me take for example. I will give an example for you. For instance, in America, and then I'll also talk about the Gambia. In America, our life itself, the lives that we live in this country, is very, very, very stressful. It's work, family, work, family, work, family. Hardly do you see fun in it.
So,
There are people who can afford to have fun. Maybe those people are much more better off than you and I.
right.
But for an average person who lives in the middle class, or for an average person who is, let's say, poor, you don't have that luxury. So most of the time, what you do is you go to work, you take care of your life issues, family, whatever is going on, and then you go right back to work again. So you can see that that has a tendency to have a lot of stress on our psyche, our mental well-being. We are stressed, and when you have stress that has not been controlled, that's what leads to a lot of mental illnesses. Now, there are other illnesses that stem from, other stressors that don't lead to mental illness. But a lot of times, stressors are the biggest driver of mental health in the United States. Now, the same thing applies to the Gambia. Gambia has a lot of stressors, but the stressors are different from ours. Most of what they stress about is just the affordability of life. How can I put food on the table? They don't even have the means to be able to put forward. Extreme poverty. Poverty can have a lot of stress on us, and that can also lead to mental illnesses. Our stressful environment, but also how we live, communally, how we live. You barely see in the Gambia people living just the family unit, just father, mother, and children. You rarely see that. A lot of times people live with extended families. And when you live with extended families, that has its own problems, because these are a group of people coming together, living together, even though they are from the same family, but they have different, let's say, different attitudes, different habits, different ways of dealing with conflict, and all that can add to the stressors that we encounter in the Gambia. And another major thing is the polygamy, and a lot of times people don't talk about this, but people don't. It's a driving force in a lot of stressors that women are dealing with in the Gambia. One thing I can tell you: no woman will tell you that, okay, I'm in a polygamous relationship and it's all fine and dandy. They will put up a front, but they will put up a front to say it's all fine and dandy, but it's always not fine and dandy.
Mm-hmm.
So imagine you have to deal with that stress. Imagine you have to deal with the stress of your own family, taking care of your children, and that with poverty, that can have a lot of stress. I will tell you this, bro. A lot of people, women, would call me after when I do mental health programs. They will call me and say, this is one of the things. The thing that you talked about is one of the things that is happening to me right now. They will tell me, this is happening to me. I can't I can't sleep. I can't, I find myself crying a lot. I am so unhappy. This is, a lot of women, and I'm telling you, Gambian women don't like to talk about their problems, but a lot of them would call me and tell me this in private. So where is that coming from? It is stemming from what is happening in our society, the way we live, how we handle things. And our religion also is part of that. Now, it's a very, very delicate issue to talk about,
Right.
because people don't want to talk about those issues. But, if you have to be honest with yourself, those are things that you have to bring to light when you're talking about stress and some of the mental and emotional issues that we encounter in the Gambia.
True. Like we all come from a different background, and then we have seen the Maslaha syndrome, and we have seen the situation where, just in connection to mental health, where you are arranged to marry to someone, either your cousin or your cousin sister or your cousin brother. When you are, I know they will say, "Nakumumu final letter, na mi for wolong," and then you grew up in that type of an environment. Could that also be a major factor in terms of mental health, or causing more stress that leads to unhealthy relationships?
Definitely, definitely. Just think about it. You just said arranged marriages. So that means this is not your will, it's not your wish. This is an arranged situation. Now, I'm not going to say that all of them end up to mentally or emotional issues, but that alone, having somebody arrange something for you that you are not part of, or somebody arrange something for you that you do not um, agree to or you do not like. Imagine getting into a relationship like that, right? So emotionally, you went into something, and marriage or intimate issues are very, very emotional issues. So you are going into this emotional situation, but you, the person going into it, do not have any say into whether you want to go into it or you don't want to go into it. That's one of the reasons. Say hi.
That's my wife
Okay.
there.
Hi.
Hello.
Hi, Uncle Tala. Hi.
Hello.
She's up. Okay, so you can go now. Yeah. So that's a huge driver of emotional issues, because
Right.
you are going to be in this thing. First of all, this is not if you are lucky, it may be, and if it is somebody who maybe you grew up with, this person, you know how to deal with them, on an individual basis. But imagine if you don't grow up with them, you don't know them personally. This is just maybe your aunt's child, right? Somebody who lived maybe up country, you live somewhere else. Now you don't even know how to deal with this person per se. Now you added onto that the fact that you do not even like this person.
Right.
Imagine how mentally stressful that could be.
Stressful.
It could be very, very, very mentally stressful. And what happens in those situations is that you can't get out of it. You're just going to play along just to live. So this person is living on a day-to-day basis just because that this is what society or this is what my family wants me to do. At some point, I think we don't even understand the level of stress that entails, the level of just having to bear. And that's what happens with Gambia. A lot of women are just bearing on a day-to-day basis, just bearing a lot of burden, a lot of emotional stress. We talk about this, just the concept of marriage, but then you come to just having birth and then having to deal with other stressors, having to deal with other mental health conditions like postpartum depression, those type of things. It's just overwhelming in the Gambia, the amount of stress. And I think you said something that is very, very important here. You said in the Gambia, I think that was before we started the program.
Right.
In the Gambia, they don't consider you mentally ill until when you take off your pants or your wrapper and then throw it away and run in the streets.
Right.
That's when they realize you are mentally ill. But and that is very true, because a lot of people are walking around with mental illness in the Gambia. they are not being diagnosed because of maybe they don't have access, or maybe because they don't even know whether they do have these emotional issues. So that's why, when I'm on social media, and a lot of times, these teenage boys and young men in the Gambia have an outburst just over a simple thing that you say, and then you're telling yourself, why is this person acting this way? So I step back and say, you know what? I don't know what is going on in this person's life. I don't know what he is going through. So maybe this outburst is not even what I said or what I did. This has a lot to do with what is happening in this person's daily life, and that happens a lot in the Gambia.
Right. It's good that you mentioned that. Like, if you look at the structures of our society, and there are different categories, I believe, and stages of stress that could lead to a long-term mental illness. How will you spot, like me from the village of Batapu to Kantora, how will I understand that, what are the basic signs and symptoms of abnormal behaviors that could warrant, or that could at least put some signal that I need to see the professional guys or the doctor, or go to the public health centers facilities for some early, treatment, just to understand, because we have this belief that nyama to there, and mentally ill person is never going to be cured. But how do we spot the early signs and symptoms of abnormal behavior that could lead to death, that could lead to some serious problems later in the future?
Yeah. There are a lot of symptoms when it comes to, because mental health is just a general it's an umbrella, but you have a lot of diagnoses under that umbrella. So a lot of diagnoses, for instance, you have schizophrenia, you have postpartum depression, you have depression. Even depression itself has a lot of other types of depression, right? And you have ADHD, and that usually comes with children. You have anxiety problems. You have a lot of other mental health issues that people deal with. So there is no, what I'm going to talk about are going to be general things that when you feel or when you see, then you are like, okay, you know what, I think maybe I need professional help. But that wouldn't tell you what type of mental illness you have, because sometimes their symptoms mimic each other, but they don't necessarily become the same disorder. So I can tell you, for instance, if I say sleeplessness, a lot of mental illnesses have symptoms of sleeplessness. So I cannot tell you. I can tell you one by one which every disorder, what symptoms there are. But generally, I will tell you these are things that when you see it in yourself, you can say, you know what, I need to go and see a mental health professional. And first and foremost is sleeplessness. Now, when you do not have any underlying medical issue, because for us here in the US, before we even diagnose you with mental health, we have to make sure physical health and mental health, their symptoms also mimic each other. So in order for me to understand that what you are telling me is mental illness, I have to first refer you to, let's say, a medical doctor, to your own medical doctor, and say, go and check for physical health. If your physical health comes back and all is good, that you do not have any problems. So these are some of the things that you need to look at for general mental health. If you can't sleep, and that doesn't mean you just are tired for one day, you cannot, but continuously you cannot sleep, even if you try, even if you go to bed on time, even if you are not tired, even you did everything, but you can't sleep, whether it's during the day or during the night, you can't seem to have a good night's sleep. That's one of the factors. Another factor is lack of focus. And that is, even as an adult, when you are giving a job to do, you cannot focus on one job at the same time. You will just focus for like a minute or two, then you are easily distracted to go and do something else. You can't focus. Irritability, when you have the tendency to be angry for no good reason. You just get angry for no good reason. That is also, a general symptom of mental illness. And also one of the things that, just sadness. You get sad for no good reason. You see yourself being sad, nothing happens to you, but you feel sad all the time. Tiredness, you are tired all the time, and this is not because of physical health issues, but you are just tired. You don't know why. All that also is a symptom, a general symptom of mental illness. Now, there are other specific symptoms that are specific to other disorders. Go! Don't, please. I'm sorry.
She's part of the presentation.
Yeah, today is Saturday, no school, so she's just walking around and maybe just interacting. Yeah, but there are certain specific things to, for instance, hallucinations that is very specific to schizophrenia. Delusions is specific to schizophrenia, and then you have other grandiose thinking, which is more specific to narcissism. So there are specific ones that are specific to certain illnesses, but generally, if you can't sleep, maybe sometimes you even lose your appetite. You can't eat. You lose your appetite. You can't sleep. You get irritable all the time. You cannot focus when you have a job. Those are general symptoms of mental issues, mental illness. Oh, you are like stressed all the time, and because when you are stressed, some of these things that I just told you, you will experience. Those are symptoms as well of stress. And remember, I told you in the beginning, stress is one of the biggest drivers of mental illness. So when you see these general things, I think it's it's advisable for you to go and see a mental health professional.
That's good. That's a good intervention, Mariama. And now coming back to this pandemic, we know people spend a lot of time with their loved ones, with their families, and their kids. Like they've been sitting 24 hours, using the same bathroom, using the same kitchen back and forth. Will there be any tendency of some kind of abuses or violence that could actually lead to stress or to mental health disorder? Because we have seen recently studies have shown that abuses are becoming increasing, and then people are living together. Imagine Mariama and your husband, you don't sit together for it's like this one is coming in and that one is going out. It's like the time frame is not the same. But in context, we have seen this pandemic, some people lost their jobs, they are at home, kids are not going to school as a measure to cut down the spread of this pandemic. What is the connection of mental health, and how can we live in a more better society, in a better environment in that we are put it? Like we are all together. How do we avoid stresses, abuses, and even more violence that could lead to mental health?
Yeah, that is a very, very important topic, and important point, because like you said, one of the things that we've been many people in the mental health field have seen a lot of, even me in my own practice, I would see a lot of families calling me. The bad thing is, it just breaks my heart that we can't help a lot of people, because not a whole lot of insurance companies at this time are doing, for instance, telehealth. And that's the only thing we can do right now, telehealth, which means we talk to them over the phone to have therapy sessions online. Yeah, but a lot of people who would come is that, I'm not getting along with my family. I'm not getting along with my spouse. I'm not, I'm not getting along with my teenage child. This and that and that and that is what is happening. It's happening a lot because, like you said, our lives have changed. Right now, like you said, maybe even in your own household, you wake up in the morning, you go to work, your wife goes to work. You don't see each other until maybe in the evenings. The evening is, you come back tired. That evening is such a short period of time. You don't have time to argue. You don't have time to go back and forth. What you want is to eat your food, rest a little, sleep again, and go back to work. Right. Imagine if that is your life. And then this pandemic came along. And then you find yourself where 24 hours a day. You are in the household with your wife, with your children, and Gambia may be a little bit better in this time because Gambia, at least the children can leave the house and then run around in the courtyard or whatever. But imagine if you live in an apartment here, you do not have a courtyard. So yourself, your wife, your children, you are all confined to that small space. That has a tendency to drive any stressors that you had in the past that you ignore. They all come to light at this time. You get on each other's nerves. You tell each other things that you shouldn't. You have arguments, and then you have stresses, and then you have emotional issues. So that's why this pandemic it's not only about the physical health of the people, but what it is also about is the emotional health. And then you also even have people who would use that stress to abuse somebody in the household, whether it's physical abuse, emotional abuse, even financial abuse. They would do that during this time. They will do sexual abuse. Children have been more, according to some of the studies that have been going on here in the United States, children have been more abused sexually during this time, because remember, everybody is staying at the same time, throughout the day. So it's been a roller coaster of mental health issues that have been going on around the clock in the families. And one thing I think it's very, very important is to be aware, because a lot of times what happens to us is that when we find ourselves in a certain situation, we are just driven by our emotions at the time. But if you take a break and then you become aware of your surroundings, or you become aware of what triggers you, what are some of the things that triggers you, these are the things that you can put into account and maybe prevent yourself or even a family member from having an outburst. For instance, that if I do this to this person, I would end up having an argument. This is the trigger. Yeah, this is the trigger for this person. This is the trigger for my wife, or this is the trigger for my husband, or my child gets triggered by this. What we tell our clients most of the time is to minimize the stressors, and you can minimize those stressors when you know what the triggers are. What triggers me, what keeps me, or even when it comes to sexual abuse. Okay, I'm looking at something or a certain behavior that is very abnormal. What do I do to prevent it before it even happens? How do I do to address it? A lot of times in families, we don't address things until they become an issue. So you have to be very aware. You have to be very observant. You have to know your partner. You have to know your child. And if you know them, you know what their triggers are. You know the circumstances that can create those triggers. Those are the things that you minimize. You minimize the triggers. You minimize the instigating factor. Then there is a very high chance that you won't have that problem. So be aware, and look for those triggers. And when you see the triggers, try to minimize them before they become an issue.
Well, try to know and see your environment. Mariam, I know talking is not very easy, and today being a Saturday, and we all know what it means. I will give you a short break where you will also put things together around your area, and then we'll come back shortly after it's less than 10 seconds just to have yourself and prepare for the next episode. Thank you very much. If you're just tuning or watching, this is your Heart Talk Show coming from the Sukuta Community TV with me, Tala Jobe. And today we have Mariama Samateh, a Gambian based here in the United States. The topic is mental health. Thank you, and we'll be back shortly after the break.
Ninka makatul kebani tak dini ul bedoyaring oka dini ul lain doya ala le besan bala gaman han na ali bagan ma yin sama lamin sama ba sama singa da kunda alsa sabarota misil me am sabarol asa ko al bese duwani sawan tewe ka dini
on the beat.
Adimin teleka keba ya without ifama. Doti je min selo apart from ibama. Ndoya batale biring alaye bondim bulu ninja mante miskini ngana kelol be kelen damma. Tumo min nankata karambungo to lonchi tembulu konyeta matol numbalu olunte batum puriyemuru. Ndoya batale ka understand mimbe kering. Ndoya tanyao nya ngalo ne kule mantaku. Dunim finti bulube kunta benin koronto. Kijoka mununtu. Balafa balatio ka furuntu nyajio ka buruntu. Ogo sama suruntu. Nao ka kumbole woluma fweka kuruntu. Munatu. Ntolbe kela nyadi le suntu. Suntu ya jiso kunta e kalola te kunta betama la fanti. Na meta e santo juba betiamu la fanti. Ala tala muna na entoltu. Badi ngol siati la sango tabira botala meje. Santen karten kukulini sanda malon keje. Meje fobasa na la sangolo la banta keje. I miss them. Bari malo mune bekala koten keja ninkeje. Ninga mire la kola banga kamfale wato dol. Ninda samata mkontontante simana wato dol. Wakona nga moljele milia sinkiri kensa ujonki wato dol. Just prike fansutra kwebe kontontable la wato dol. Lesson learned. Omukarandi rolled. Idi minta nyao nya salon dole diminted. And even though na achievement all tabana ka konti still malon foi be proud lo kwedi mo sota mimbo konti baba when bama sirin denyinande jarin tenne denyina lila eh baba when bama sirin denyinande jarin tenne denyina lila. Hani bi manyi nela luolun sela kuwa calculate. Fajaman le muta dingoti na duta yang isolate. Nyantalo nela ko fala kanu muka duplicate. Nobody was there, come congratulate, biring ka graduate. Aba kulin na sang. Bosol be farin na account ol be larin na sang. Kodal sandale bunjam balle be lokan nun sang. Efudu tala nala family bebe UK le sang. Mero data makanata be kadia America. Madi business if so college brother we see vision sang. Yes sir Mr. Officer demo be service. Lamin wo be Germany a telegram call sign. Din doctor ning accountant ol ngalo se die. Dana take rapal di ba malon fo se kuye. Siwo balunya wasn't really working for me. So first time fansu call ke puru family e balu mobe dalu fence ringole nyafu kodo etinya na lifestyle is different ba. Take my call ninka swagu ni $1,000,000 imotol purchawole malu. That's what to everybody that look down on us. Now I'm looking down on all those that look down on us. And even don't say million sema bondi lenga konti still malon foi be proud la kwe dingo sotole mimbo konti ST. Eh baba when bama sirin denyinande jarin tenne denyina lila. Eh baba when bama sirin denyinande jarin tenne denyina lila. Yes. Rest in peace, Balamusasingan. Rest in peace, brains. Alma alaja usulya.
Well, thank you very much. That was a very powerful song there by our own Gambian brother. And you can see we can even relate our topic discussion on this, from the day that your daddy passed away, the way the community come into play. And today you can measure some of the achievement. Definitely this music, I was not expecting it, but it comes at the right time. Coming back to the topic, Mariama, we just want to go back again to COVID-19 in relations to mental health. I was, one of my colleagues at work told me, hey, now I don't have time to watch my best shows on the TV because the kids have a laptop, they have a tablet, they have their phone there, but they're still in control of the remote control. What do I do with this, man? I'm so pissed off with this. What is your advice for parents that are going through those things right now?
It's just to accommodate and adjust. Because one thing that is very dynamic about us as human beings, we have the ability to adapt to a new environment. We have the ability to adjust ourselves to a new situation. A lot of times, the most people with the with mental illness in the communities are the people who their adaptability rate is very low. They cannot adapt to new situations, because if you can't adapt to a new situation, your tendency of having stress is going to be very, very high. So for now, adapt to the situation, and have a routine. Have a routine, because it's very, very important to have what routines help us do is to have stability in our lives. You have a routine, I'm sure, in your household prior to the pandemic. You wake up in the morning. There are certain things that you do to take care of your own self. You do that. You pray to God, and then you find your way. Maybe eat something and then go to work. People don't realize those are all routines, even though they are not routines that you write down and say this is what I'm going to do from 8:30 to 9:30. But these have become routine. These are routines that have become part of your life. So when you find yourself in a new environment or in a new situation, one of the ways to be, you can help yourself adjust is to have a routine. Get a new routine, and that is, let's say, your daughter or your spouse, you all have one TV in the room, right? And everybody is using this, wanting to have you have different shows. You are going to use this TV for that. What you do is have a roster. Have a roster. Okay, so your show comes on. I'm sure your shows don't come on at the same time, but even if they do come at the same time, you can always make adjustments and say, okay, my show comes on at the same time as yours. So Mondays, I'm going to watch mine while you don't watch yours, right? Maybe we can record it. You can watch yours later, right? While I watch mine. Or you can, like I said, you can put the days of the week. Monday, Tuesday, Wednesday, I am going to be watching my show at that time. If my show comes at the same time with your show, so I'm going to be watching, but then Thursday, Friday, Saturday, that is your day. So what we will do at that time is record mine, so that when you're done watching, I will watch mine later. You see? And even at night, you can take the night to say, okay, well, when my children are asleep, I'm going to record all my shows during the day. And when my children are asleep at night, I'll watch them. So when they are up in the morning running around, maybe I don't have a work to do because I'm home, I'll just sleep. You see what I mean? So you can always find ways to schedule things so that you are not getting on each other's nerves, so that you can give each other space and create a space for yourself in the house. Even I know this is some of the things that I'm talking about here. These are for America, us living in Europe and in the West. That is probably not applicable for people in the Gambia, but for us here, we can do those type of things, right? We can go with our routine, change our schedules, and accommodate each other so that we don't have those tensions in the household. And then the less tensions, the less stress.
Right. Well, that's a very good. You have something
I was just going to say in the Gambia as well. One thing that help us very well in the Gambia is that we have these. We are not confined in one place. We are not confined in one place. So we have a chance to be able to go out, maybe even if it is in the household itself, to be able to go out and do things in the house. So yes, it's the same. You can apply the same method in the Gambia. Occupy yourself with something when what you want to do coincides with what your family member wants to do. So you can leave that and then occupy yourself with something different. That way, you can accommodate each other. You can adjust to the new environment or the new situation that is happening. And that has a tendency to have build up relationships even better and build up your own emotional and mental well-being.
Well, that's very good, Mariama. I think now we have got a lot of information concerning this. And what might wonder, what is Mariama doing in terms of, reaching his or her arms, in terms of addressing? Because we know the information is there, people are informed, they educate, but behavioral changes too, accepting new lifestyle is always a problem. What is Mariama doing in her capacity with other groups, perhaps, extending their knowledge to the Gambian people to understand basic things, I know you are part of an organization that you voluntarily been doing a lot of activities. This will be an opportunity for Gambians and anyone watching to understand that Mariama and her team of people are also engaged in some bit of development, complementing the efforts of government, helping existing NGOs in the country in addressing such a major public health problem, which is mental health. What is Mariama doing with her colleagues in terms of helping addressing these mental health issues?
Yes, thank you for that question. There's a lot of things that we are doing. One moment. I'm so sorry.
It's all right.
What COVID-19 can do, everybody is home.
Right.
Yeah.
I have to drive mine too. They all went, because like you were saying, they all went and said, Daddy, are you ready? I'm not ready yet. They all went
Exactly. Yeah. My husband is in the fridge looking for things and the noise is all over. Yeah. Thank you for asking that question. And I'm sure you know about my organization, GAMSA.
Right.
It's Gambian Association. That stands for Gambian Association on Mental Health and Substance Abuse. What we do in the Gambia, we've done a lot of projects in the Gambia. It started off with, that idea actually came about with the youths that went through the back way to Libya, and we also what happened to them on their way to Europe. So a lot of torture in Libya, in those Arab countries they went through, and after seeing that on display for a period of time on Facebook, I think this was like 2 years ago, 2 years ago, I decided that this is something that, it didn't sit well with me, in that I am in this country day in and day out. I'm helping people in America deal with mental health issues on a daily basis. Here are my own people, because at that time the Gambian government was helping them to return home. And what I did see that when they return home, what happens is they just give them back to their families after going through all that trauma on their way to Europe. So when they get home, no assessments, nothing, absolutely. They just pick them up and give them up to their family members. I looked at that and I said, no, this is not what is supposed to happen. These people need to be assessed. They need to get some help, and before they can be integrated back into the society. So we did a fundraiser. We were able to raise some funds, and then I put together the mental health professionals, Gambian mental health professionals in Europe and in America. So we formed an organization. But before we formed that, we were able to do this. The money we collected from the fundraiser and the money from our own packets, we used that, and we did assessments throughout the country. We went to all the major health centers in the Gambia to do an assessment. And so these assessments were done to identify any of those returnees who have trauma, any of those returnees who have any other mental illness, to be able to help them. So we did that throughout the country. But what we were able to find out is that at every health center that we went to do these clinics, a whole lot of people come to get help. Sometimes you would see lines and lines and lines of people, even those that have not gone through the back way or whatever. A lot of people come because they need mental health support. So we took names, we took some data from those clinics, and we took some data from those clinics, and based on that data, when the data came back, we looked at it and we know there is a crisis, mental health crisis in the Gambia, right? So we told ourselves that we cannot just do this one-off. Let's form an organization that can at least address some of these issues. That's how GAMSA came into being. At first, it was just going to be about mental health. But when we did the clinics, we realized some of these mental health issues are driven by substance abuse. Substance abuse. So you cannot help the person mentally address their mental health concerns, whereas they are still using the substance that actually drives them to have mental health. So we put them all together, and we are finding ways to address the issue. Now, to cut a long story short, we've done a lot of projects in the Gambia. We've done clinics, we've done sensitization tours inside the Gambia. We've collaborated with certain organizations to sensitize women. We've done that. But one of the things that is very dear to me, that I think will bring about more change on the ground, is community mental health. Because one thing is very, very true. America has more mental health patients than the Gambia. But most of the time, you don't walk around and see mentally ill people in the streets of the United States. You don't see that, and there is a reason why. There is a reason why that is. The reason is that they have community mental health. Before I owned my own practice, I used to go into the communities to meet with these mentally ill people. Some of them cannot even afford to come and see me. I have to go to their homes to provide them service in their own homes. I go to the schools to go into the school system to give therapy to these children who cannot focus in class, who have ADHD, or who have disruptive behaviors and things like that. So I go into the schools to find them where they are at and give them mental health. I go into the prisons to provide therapy to clients in the prison, right? So as you can see, I'm telling you this because you can see now I am taking the service to these people. They cannot come to me at that time. For instance, the child who is in the classroom cannot come to me at that time because they are in the classroom. But I can go to the school. Yeah, I can go to the school and pull this child out for 45 minutes and help him with some coping skills that he can utilize while he is in school. So I took the service to the child. And the prisoner cannot come out to come and see me. I go into the prison to help this person who is in the prison, to help them be able to mentally cope with their situation at that time, right? And let's say an elderly person who cannot come, who cannot drive to come and see. So I take the service to them. That is what is called community mental health. That is my goal, to see that happen in the Gambia. And that's what GAMSA is working on right now. As we speak, we have a very good mental health workers in the Gambia. One thing about mental health, if you go through the course, if you go through mental health, you become very, very, very passionate about it, right? And you can see that with the mental health workers in the Gambia, they are very, very passionate group of people. The mental health manager is Bakari Sonko. That guy sleeps and breathes and dreams mental health, right? So they're doing a tremendous work to make sure that they can change the face of mental health in the Gambia. So for us, the job has been easy for us because we have a group of passionate people who are on the ground, whose life is to change how the delivery of service of mental health service in the Gambia. So we have good partners. So we partner with them, and through that partnership, through that hard work, now we have mental health professionals. They've divided Gambia into 7 catchment areas. 7 catchment areas. So in all those catchment areas, there is like one big hospital in all those 7 catchment areas. So we have mental health professionals attached to those catchment areas. So those mental health professionals are building up caseloads for all the mentally ill in those areas, right? So that at some point, we are not there yet, but this is the goal. That's what we are working on, because we are working on to provide them with motorcycles or some type of a vehicle that they will be able to use to travel from one home to another to provide service on a monthly basis to mentally ill people in all the areas in the country. So that's what we are working on. I'm very excited about this project. I don't want to say too much about it, because what I do find out is that when you talk about what you were doing, sometimes all of it doesn't materialize. But we are working on it. Right now, we have all the 7 are deployed. to their catchment areas. We are working on how they are going to be able to reach these people so that they can go into their homes, let's say 7 days, 1 month, once every month, give them medication, identify who are the mentally ill people in that area, give those that need medication, give them medication. The ones that don't need medication, at least give them some counseling to be able to do that. And we are going to do that all across the Gambia. The goal is maybe 5 or 6 years from now, we wouldn't see a lot of mentally ill people in the streets. Care would be coming to them wherever they are. They will find care. That's the goal. Fingers crossed.
Well, that's a very good step. And then when we talked about some of these programs, one's mind will come to finance and sustainability. It's key because as much as you have a very crafty, very beautiful ideas, finance and sustainability is always a cause. Do you face those things as challenges?
Yeah, actually, finances is always a big challenge, because I would love to have a car for each of those people in the catchment areas, or maybe have Layla, please, maybe have two more. Actually, what I actually even wanted, what we wanted is to have not only a mental health provider, but have a case manager. You have a mental health provider, a case manager, and a therapist, and like what I'm doing, a psychotherapist. Because so you will have a psych nurse, which is the person who would go and check whether these people need medication and be giving them medication. Then you have the case manager who would put all the cases together of all the mentally ill people in that particular area, have a caseload of the mentally ill people, mentally ill patients, and then you have the therapist, the psychotherapist, who would be providing the therapy. Because not all mentally ill people need medication. Some of them only need psychotherapy. As we speak right now, there is no one, not a single Gambian that I know who is a psychotherapist. Yes, there are people who did psychology, but they didn't do clinical psychology. So you cannot call yourself a psychotherapist when you have no clinical knowledge, right? You are a psychologist, but you don't have the clinical skills. So I don't know of anybody who has. I know Bakari, the mental health manager, he is a psychiatric nurse, very well versed. Bakari is one of the best. If we have 2 or 3 or 4 people like Bakari in the Gambia, yes, put it down. If we have them like that, Gambia would be better off. Right. But we don't have psychotherapy. So my goal is to have some, psychotherapists trained, to have them trained, so that we can have these 3 professionals in all the catchment areas, the psych nurse, the caseworker, and the psychotherapist, and then provide a wholesome service to this mentally ill population. That's the goal. But what you ask is a very, very important thing, which is the finances. Everything that GAMSA has been able to do has been out of our own pockets. We do not have any funding. We do not have any funding apart from the fundraiser we did on Facebook, where people chip in. Right. Everything else that we've done has been out of our membership dues. In the Gambia. So it's coming out of our own pocket. The goal is hopefully we will get some type of funding, and that's what we are looking towards. We've done certain things towards that, so hopefully those things will materialize. When we have that funding, we will be able to, maybe. For me, I would love to give them each of them a car to be able to do these functions. But if we don't get a car, maybe a motorcycle for each of them, so that they can travel to meet these people where they are at, to be able to provide service. So all that is funding. Funding is a problem, and we are looking into all funding areas. We've looked into them. We've tried some funding avenues. So hopefully some of those things would materialize. And when they do materialize, these are some of the things that we intend doing. But our goal also is to train for instance, Gambians who can afford these services. One thing about Gambia is this, Tala, is because even people who can afford, still want free services.
That's
You
true.
see what I mean? And you know, in the countries that we live in this country, the reason we have sustainability is because ordinary people are willing to pull out of their own pockets and pay for their own care. You see what I mean? It's not
Right.
We have people who cannot afford, and that's everywhere in any country. If you have people who cannot afford, you need to help those people. But if you can afford it, you need to come out of pocket and support these causes, right? So for us, if we identify people that we can go and on a monthly basis and provide services to, we are not going to charge people who cannot afford it, who do not have the means. But at least if you have the means, you need to chip in something so that we can maintain this program. That's the goal. Everything cannot be, out of we going out and looking for charity or looking out for funding or whatever. We as citizens can do this. We can do this if we put our minds and hearts to it. We can do this if we are focused on making sure that it's sustainable. Your funding partners are not going to be there every single day. You have to plan for these things so that when they are not there, you can do this kind of, you can continue this kind of programs. So that's the goal. We will charge, if we get to that point, maybe there will be some nominal fee so that we can buy gas for the people who will be going and meeting, but that is for people who can afford. You cannot charge people who cannot afford. You see what I mean? So that's where it is going, where we are headed.
Well, that's very good. And one thing we have to commend, because we know being part of this other part of the world in America and Europe, and you have one passion, and that is to complement and give back to your own people. Because it's sad that most of the time we don't tend to give back to our people. Basically, coming from a background like an NGO, I think I only worked for the government for like 3 or 4 years, that is tourism. But my entire work was dealing with a non-governmental organization. I know there are donor fatigue. People are tired of the same activity, the same project, the same funding. After 10 years down the line, you cannot measure any impact. Because at least if Mariama spent $10 in the community of Sukuta, after 10 years, Mariama should be able to say, not $10 let's spend, at least now, this is now improving. That $10, $15 has been, metamorphosis to different angles. There are existing groups too in the Gambia that have huge fundings. And I said this, I'm still part of a board. I'm still a board member of one of the NGOs in the Gambia. And I said, we have the resources at home. We don't even have the capacity in terms of exhausting those funds. Like if you go to the UNDP, United Nations Development Program, they are headquartered. They have an office in the Gambia. You have UNICEF, you have WHO, you have World Health Program. They all have their line of budgets. But Gambians don't even know. They will say WHO is not an implementing body. They partner with groups like existing groups in the country. They say, hey, we have a program on community sensitization on mental health. Do we have a budget line? Yes, we have like $500,000 here. But in the Gambia, credibility of most of the NGOs is question mark. Right. Because they are not transparent. They are not accountable. They cannot even put reports together at some point. One NGO manager of one NGO will be there for life. So most of the time, I'm talking to you based on experience as somebody who is still even a board member in some of these organizations. They say, hey, we cannot rely, like you said, donor. There are some what they call internal country mechanisms that they have funding existing there, right there. But tell me, they will say, we need to see your setup of board of directors. We need to see how transparent, how you communicate among yourself, how transparent, and how does your program impact the life of this woman in Kian Keneba, or in Jara Sutukum, or in Sukuta, or in Nyumi. What is so different with Mariama's organization that people can trust and say, hey, we know what we are doing. When you partner with us, you never know, someone could be listening to this program. What is there that is going to be so different from your organization in terms of, impact assessment, in terms of, filling that gap that we think has been there for like 10 good years? Because most NGOs will tell you, Aladdin, give us the money, we'll do it. But what are you going to do? There is a gap that you need to fill.
Right. Right. I think you've raised a very important point here because, like you said, the donor fatigue is because of they keep giving and they don't see the results, and or maybe they keep giving and people that they give to are not transparent enough to show people what they've been doing. Thankfully for GAMSA, like I said, we never had funding, so we have internal mechanisms in place where whatever we do, we have our accountant, we have whatever. We actually, every year we file our taxes in the United States to tell United States government what we get, even though it's our own money. We tell them this is the money we put together and this is what we spend it on. So we file taxes in the United States, and those tax documents can be available anytime anybody wants. But the only one time that we got a funding from the Gambian people, which is the fundraiser we did online. We were I think our organization was an example in that regard, because for anyone who is familiar with Facebook, when you do a fundraiser on Facebook, you don't get your money right away. You know, it takes a little while before you get the money from Facebook, and Facebook will take some deductions out of it. Excuse me, we'll take some deductions out of it and then give you the rest of the money back. So when we did that fundraiser, Facebook was taking a lot of time and our people on the ground needed help. We took the money out of our own bank accounts and sent it to the Gambia. We showed the receipts on Facebook. We put it on Facebook for everybody to see the receipts, what we spent, what we sent to the Gambia. And that was out of our own money. It took Facebook nearly a month. That was, that was the beginning of when Facebook started doing fundraisers. So I think we were also learning at that time as we go. So it took them about a month before we were able to get our monies back. But that came out of our own bank accounts. Myself and the vice president, Desiree Njai, we came up with the money so that Gambians can have the money, and then Facebook can pay us back. And that's what basically happened. But we showed every receipt, and we still have those receipts. We showed every receipt where all the money went and what was done with the Gambia. We actually told the Gambians on the ground to tell us where every money went, where all the money went. So they showed us receipts where what they spent and what they spent it on. And that was, for me, that was very, very it was a sigh of relief for me, because you hear all these stories when you send money to the Gambia, they don't do it for the right reasons and things like that. So when we send that money, and that was the first time, and my reputation was on the line, because that was the first time I got engaged with anything nationally in the Gambia. So I was like, oh my God, what's going to happen? But like I said, the people in the Gambia, the mental health community in the Gambia, headed by Bakari Sonko, these are very outstanding Gambians, outstanding citizens who work hard, who are very honest people, who, when you give them your money, they will show you where the money is, and you will see it with your own eyes. Because the amount of people they were able to reach just with $5,000 was just outstanding, enormous. To me, I was like, I don't even know how you guys did it. And they did it. We were seeing it in real time. They were doing videos. We were seeing all these things. So the transparency was just out of this world. So for us, I think what you said is very important. It's very important to be transparent, because this is not about us. That is why you don't see, I'm not saying I don't join Gambian groups. I do join Gambian groups, but I'm not very, very like super active in any Gambian group other than this mental health group, because I know you can make us accountable. That's the only group that I can be accountable to. That is the only group that I know what I'm actually doing, So even if I join another group, I'm joining those groups in terms of mental health issues, because that's what I know. I'm not going to join things that I don't know what to do about. So that's what we are doing. And I think we are a very small group, but if we have a large membership, I think we can take this mental health issue to a whole lot of places that we will not even think about, because the people that are in this organization are people who are clinicians who are practitioners in the United States. We know what we're doing. We know how we can transport those ideas from the United States into the Gambia, and it can work there in the Gambian context. We know that. So, like I said, we are small. We just don't have enough people to put all the money together. But hopefully, we are working methodically to make sure that, whatever we do makes an impact. Because it's one thing to put money into something, but it's another whether what you did made any lasting impact. And lasting impact is what is more important in whatever you do.
Well, thank you very much, Mariama. This has been a marathon discussion. We have touched on almost everything. And this, I have to say once again, thank you so much, knowing what Saturday means in the US and knowing what Saturday means with kids around. We just want to thank you. But before that, maybe Mariama will want to say one last word or two, just to make a few recap of on mental health and the way forward, especially putting Gambia in context.
Yeah. Thank you very much, bro. What I want to say is that in a Gambian context, Gambia, let's not treat our mentally ill patients as outcasts. The stigma around mental health in the Gambia is enormous. We have to understand mental health is just like any other illness. It's just like diabetes, cancer, any other high blood pressure, any other disease that people have. It's just similar to that. It's just a chronic condition that somebody is dealing with. When people have those illnesses in the Gambia, the physical health part, they take them to the hospital, they take care of them, they get them the help. But when you have mental health issues, they keep you home, or they take you to one of these local doctors, these traditional doctors, and they tie you up. They tie you up and they do. That's not the way to go. There are a lot of things that, a lot of help that is available in the Gambia in terms of Western medicine that can help a lot of mentally ill people in the Gambia. Take your mentally ill people to the hospitals. Take them to regular hospitals, just like you take your diabetic patient, your high blood patient, your pregnant woman who is about to give birth, just like you take them to the hospital. Take your mentally ill people to the hospital, and they will get the help. Now we even have mental health professionals attached to Fajikunda, RVH, Serakunda Hospital, all these Brikama Hospital. All these hospitals have mental health technicians in those hospitals. Take your family and the other catchment areas, Bansang, Basse, and anyway, I have them on the list. But all these catchment areas, we have mental. Take your people to the hospital. Take them and help them. Help them out, because just like physical health, they can get better. They can be productive members of society. So let's help each other out, and don't just leave them home.
Well, thank you very much, Mrs. Mariama Samateh. Like I said, the community and the entire administrative team of this Sukuta Community TV, we are still at an infancy stage, and I know this will not be the last time for you to come on board again. Well, use this as your medium, as your platform. We are all trying to do and give our best to country. Well, thank you once again on behalf of the team in the UK and the team in the Gambia. We just say thank you once again for coming up, and have a great weekend with your family.
Thank you very much for having me. Thank you. I appreciate it a lot. Thank you.
Well, thank you so much, guys. Say bye-bye until we come your way next week.
Damendo muna na Gambia ni ajube siolube muzungiri neti ndamanda buluda mbe mubadi ngirindiri ni ajibe jaliba mpala mandinga